Okay, so it's 11 o'clock. I do want to start on time. Some people were, took the time and got here ahead of time. So first of all, I'm very excited to open the first kind of pilot Ask the Expert session hosted by American Friends of Soroka Medical Center. And I think now more than ever, we're feeling a global village. Everybody's here together. It's a global pandemic, and also technology is allowing us to connect from all over the world. So we decided here at American Friends of Soroka Medical Center to really take advantage of that. And we hear that a lot of people have concerns and questions, and there are a lot of sources of information. So we thought that we can bring the experts, field professionals who have up-to-date information to discuss and answer some of your questions. So I want to present the Executive Director of American Friends of Soroka Medical Center to present the two speakers. Okay, Rachel Heisler.
Hello and welcome everybody. I want to give a big thank you to you, Pazit, for initiating this and executing this really extremely appreciated and of the moment conference. So thank you, Pazit. Extraordinary times really require extraordinary strong leaders, and the strengths of our leaders emerge and are very clear and visible and appreciated now. So I want to thank our president, Jay Selman, for his strength and leadership that enables us as American Friends of Soroka Medical Center to unite and respond in such a unified and proactive way. I'd also like to thank each and every member of the Board of Directors of American Friends of Soroka. We're honored today to bring you two world-class experts. From Soroka in Be'er Sheva, we have Dr. Jacob Dreiher. He is an MD, a Master in Public Health, and he also has a PhD degree from the Department of Epidemiology and Health Services in Ben-Gurion University. He has been the Deputy Director of Soroka Medical Center for the past 4 years, and in fact, he led the Joint Commission efforts at Soroka, and Soroka, the results of that bear witness to our excellence in battling infectious disease, because we're the only institution in Israel that has maintained Joint Commission accreditation for 10 years. So his leadership is evident. He's also board certified in internal medicine and lecturer in the faculty at Ben-Gurion University, and has over 100 peer-reviewed publications and abstracts. So he's a true leader in world global health. From America, we have Dr. David M. Goldberg. He's an assistant professor of medicine at Columbia University. He is part of the faculty practice of Columbia University Medical Center and sees patients at New York Presbyterian Medical Group in Westchester. Trained and educated at the top academic medical institutions in the country, Dr. Goldberg provides a wealth of knowledge and experience to the New York society. He is a staple in the Scarsdale medical community, where he is the go-to doctor for all infectious disease issues, and he's a trusted voice based on his decades of leadership and experience and his fellowship in infectious diseases at Columbia University. So we are truly honored to have him. By the way, his special interest is in travel medicine, Lyme disease, and community-acquired infections. So the perfect voice and expert to answer our questions today. Thank you to both Jacob Dreiher and David Goldberg for participating.
Okay, right, if somebody can check with David Kimia on the phone, he's trying to get up in the call. Okay, so thank you very much, Rachel. And we're gonna allow each presenter, the two doctors, to briefly present the situation right now from their perspective, a few minutes, like 3 minutes, and then we're gonna open to, I have here about 3 questions that I heard over and over from people to ask, and then we're gonna open it to your questions. So first of all, Jacob, why don't you present what's going on right now in Soroka, in Israel, and globally as you see it?
Okay, so just a quick overview. So I prepared a very short presentation. So this is the world as we see it today, with about 250 cases worldwide, and you can see that Israel is about 700 cases already. Actually, this number is not so accurate because the real number in Israel now is some 100,000 people in quarantine at home, with 705 positive for the COVID-19 virus. You see that some of them are hospitalized, some of them are either in home hospitalization or hospitalized in special hotels. Some of them are pending decision whether or not they will go to hospital or stay at home, and some of them recovered. None of them died, fortunately. So all these efforts of home isolation, everyone that is in contact with the patient is to stay at home. The reason we do it is that we want to flatten the curve. If this line here is the maximal capacity of hospitals, and we can move from this curve to that curve, so that at every given point of time, we'll have enough beds and ICU resources for everyone, then we can move through this challenge successfully. So I just want to show you what we did here in Soroka. We were among the first hospitals in Israel to open a dedicated COVID-19 unit. The unit is in a separate building outside the main buildings. We are among the first 4 virology labs that perform PCR for the virus with very high output, like hundreds of tests a day. And we were the first in Israel to operate a separate respiratory emergency department, so that everyone that comes to the emergency department with respiratory syndromes is separated from all other patients, and then we avoid infecting each other. So for those of you who know the campus, this is where the special unit is located. And you can see that if somebody comes to the emergency department, which is down here, we take them across the road, not through the campus, to the unit. And if someone comes from home, we have another gate. They can go directly from the street to the unit. Now I'm going to show you a short clip that goes inside the unit. This is how it looks like from within. Just a second. So this is the entrance to the unit. This is how it looks like from inside. These are the rooms. You can see that they are well kept and separated from each other. Everyone has all the equipment that they need in the room. We have tablets for the patients with free Netflix. They have enough supplies for their stay. We stock it every few days. And they can communicate with the physician on the tablet, so they don't need to enter the room. We have equipment for monitoring the patients. They can make food for themselves. They have cabinets that deliver the food, like from the 2 sides, and this is the yard where they can go and breathe some fresh air without interfering with other patients.
Okay, thank you very much, Jacob. Now we're going to move to Dr. David Goldberg to tell us a little bit about about the situation, maybe from the New York perspective and from his own experience. David, please. Wait, David, unmute. There you go.
Am I unmuted now?
Yes, we can hear you.
Great. The situation in the New York area is simply that the virus is widespread. We all know that the largest numbers initially were from Westchester County, but it certainly seems to be throughout Manhattan, Brooklyn. Almost everyone, I think, has probably been exposed at one point or another, whether they were aware of it or not. It appears that many of the cases, especially in young, healthy people, are very mild. It might seem like nothing more than a mild flu or the common cold. And in retrospect, we probably started seeing cases as far back as January, but of course they occurred in the middle of the flu season and the common cold season, and there was no reason to think at the time that's what we were seeing. But it's probably been building up in the community now for about 2 months or so. We expect the numbers to rise quickly. A lot of that now is because of testing. Finally, at this point, testing is readily available, but in retrospect, that should have happened several weeks ago. The main concern right now is that, as Dr. Dreiher indicated, we're concerned about healthcare facilities being overwhelmed. We don't have enough gowns, masks, gloves, and personnel. I know a number of healthcare providers, doctors and nurses, who've already been told to stay home, either because they have the coronavirus or because they were exposed to somebody with the coronavirus. I fully expect that some of the doctors in my office will be drafted to start working in the hospital, and that's appropriate. That's what you have to do. So we're concerned about the hospitals being overwhelmed. And the most important thing, which has been emphasized again and again by our public health leaders, is social distancing. And this is so simple, but it's also very difficult. We are, as humans by nature, social animals, and you really just, as far as possible, need to stay home and close the door and not see other people. You need to limit your trips outside, only go to the grocery store or the pharmacy, and if you go, try to go during off-peak hours. We all know there's certain hours of the day when it's busier than others. You want to keep your distance from others, and you want to plan, so you only have to go once every week or two instead of going once every day or two. And that's what we all need to do in every way possible. But it's in the New York area, it's widespread, and it will probably be widespread in most areas of the country fairly soon.
Okay. So I'm going to ask you some questions that I hear. And I'm going to start with, what is the most common question that you hear from people these days?
There are so many questions. I would say the most common is people asking if they can visit their grandchildren, or the parents of the grandchildren asking if they can visit their elderly parents. And the answer really is no. You really should stay away from them. And that's very, very hard. It's hard for the grandparents and it's hard for the grandchildren. And even the middle generation, the grown children really should stay away from their parents because they might have a mild case and not even know it. So the distancing applies even to loved ones, and it applies to Seder, which is around the corner. I don't think the recommendations are going to change at that point. It really means not having a traditional Seder this year. I'm sure that as we get closer to the day, smart people come up with some alternatives so we feel that we're celebrating the holiday, but that's going to be hard for everybody.
Thank you, Dr. Goldberg. Dr. Dreiher, what is the most common question that you hear? You may hear a different question being in the hospital.
Yeah, most of the questions that I hear is very similar. Like, I was told that I was in contact with a patient, or I just came from abroad. Is it really necessary to stay at home, and so on? So obviously, flights from Israel and to Israel for medical personnel have stopped. We can't go outside, but still some of them met patients in Purim parties, on the train, and so on. So they don't believe they get those SMS, text messages from the authorities saying you have been in a contact with a corona patient and you need to stay at home. Is it real? Yes, it's real. Stay at home. Don't come to work when you're isolated and so on.
It's amazing that there is the capacity in the implementation of actually texting somebody where they've been, and I'm asking, what is it different between Israel and America in that sense, in that emergency preparedness, and what can America learn from Israel and what can Israel learn from America? Who would like to address this first?
I think the most important, if I may start, the most important thing is the importance of quarantine. And although it's a little too late now, that it's very important if you have somebody arriving from a place where they might have acquired coronavirus, you have to quarantine them for 2 weeks after arrival. And we didn't do that. At this point, it's probably too late, but I know Israel has been very strict about that. I've received a phone call from a patient a couple weeks ago. She had been in contact with some young Israelis who'd been to APAC, and then the Israeli students were told they had to be quarantined for 2 weeks after they arrived back in Israel, even though they had no contact with anyone who actually had the coronavirus. And my patient asked, should I be alarmed? And I just said, no, they're just being very, very careful in Israel, and all credit to them. We did not do that. When Americans arrived back from China in December, January, we did not quarantine them. They were American citizens. They just went home. And the same happened when Americans arrived from South Korea and from Italy. The concept of quarantine, Israel has done very well with that. And we could have learned from that, and hopefully we'll learn the next time.
Thank you.
So I want to add that, as you know, Israel has a very strong public health primary care system. So this was one of the strengths that helps us with flattening the curve and so on, with the detection of patients. So in addition to quarantine, as Dr. Goldberg said, we have MDA personnel coming to your house, testing you if you have any let's say that you are in quarantine and you have some symptoms. You don't have to go to the hospital and infect everyone. The MDA comes to your house, takes the swab, it's sent to the lab, and then you get notified if you're positive or not. And then your primary care physician calls you and decides whether you should go to the hospital or whether you can stay at home and be monitored with the telemedicine equipment and so on.
Can I just add one other thing? That I think maybe the biggest lesson we can learn from Israel is that in Israel, I think there's a very strong sense that we're all in this together. And I think that spirit may be more important than any particular policies. And I think in the United States, partly because of our culture, partly because of our heterogeneity, partly because we're so big, I don't think a lot of them, I think there are many Americans who don't feel that. And I think this is the take-home lesson. We're all in this together. And we can learn that from the Israelis.
Thank you. I'm gonna move, there's a question that now Karen wrote in the chat, and also it correlates to a question I had ahead of time. If someone that has a cold symptoms at home, fever and cough, or someone has shortness of breath, how do you know when to go to the hospital, or how do you know whether the shortness of breath is anxiety or something else? Obviously, there's a lot of nervousness going on. How do you know when you need to go and how to self-diagnose yourself?
I can just tell you what we're telling our patients right now. There's really no way to know if it's coronavirus or not without doing a test. And even though the tests are available, they still take a few days to get back. So the rule of thumb now is anyone who has symptoms that might be coronavirus, we assume that it is. We tell them, first thing, quarantine yourself, go to your bedroom. If you're married, try to sleep in a separate bedroom if that's possible. Use a separate bathroom if possible. If it's important to establish a diagnosis, we do tell them to go and have a test, but there's no way to know for sure. The second part of the question about shortness of breath, how do you know whether or not it's anxiety? That's one of the most common questions I've been getting over the last few days. It's hard to tell. What I tell people is try walking up the stairs. Do you have more trouble breathing climbing the stairs than you did a week ago? If the answer is no, then there probably is anxiety. Sometimes it's hard to tell. Shortness of breath is the #1 reason to go to the emergency room. If it's really just fever, cough, other symptoms, stay away from the emergency room. But if you're short of breath, you need to go. The other thing I tell people is that if you're really not sure you're short of breath, you're probably not. If someone's really short of breath, it's not a mystery. It's pretty clear you are. So if you're not sure, most likely you're not.
Okay. Yes, Dr. Dreiher, would you like to add anything?
I think Dr. Goldberg covered it pretty much.
Okay, I'm going to go to the next question. And from Debbie, it also correlates to another question. So Debbie, do you want to ask your question? Or do you want me to?
You can ask it.
Okay, so Debbie is asking, if you get coronavirus, do you get later immune to it? And I had the same question on my notes here.
My understanding is no one knows yet. For most viral infections, once you have it, you can't get it a second time, but there are exceptions, and the virus is just too new to my knowledge, and I would like to hear what Dr. Dreiher says. I don't know of any evidence that one way or another whether anyone knows yet.
Okay, Dr. Dreiher, would you like to add?
Yeah, I think since they are working on a vaccine for the virus, then my logic would say that you can get some immunity for that. Otherwise, there was no point in developing a vaccine. But as Dr. Goldberg said, it's really new to us. We don't have a vaccine yet, so we'll just have to wait and see whether the vaccine, when it is developed, even works, or if people can be reinfected with corona. The evidence that we have so far is that those cases who were presumably negative and then get positive again, they are probably not reinfected, but rather were tested with not sufficient sampling or with the delay between sampling and testing, so we have doubts about even if this exists.
Okay, I think George Alexander has a question. You need to unmute your microphone.
Are you hearing me now?
Yes.
Can you hear me now? Yeah. My question is, if somebody who is...
Just present yourself, your name and where you're from.
Oh, yes. My name is George Pontual. I'm a journalist from Brazil, and I live in New York City. My question is, if somebody who is shedding the virus takes an elevator, sneezes, then leaves, and I take the same elevator, I'm breathing that air, what's the likelihood that I could get the virus?
It depends, I think, on how long the patient stayed in the elevator and how much did he really sneeze all over the walls and whether or not they were cleaned after that. If it's just a short trip and you really just did a small sneeze, then probably the viral load is not so high and you wouldn't be infected, but I think the evidence to that is very limited.
Okay. I have a question here that a lot of people need to go and get food, you know, even if it's the bare minimum of going out of the house. Is there any risk taking when you touch shelves and food items that other people touch, and what can you do to minimize the risk?
It does not seem to be a significant risk. It is true that the virus appears to be able to live on inanimate surfaces, whether it's packages, tables, counters. able to live for a few hours and maybe even a few days. But the top medical experts at this point do not think that that is a frequent means of spread. So the bottom line is exercise reasonable caution, but you can probably go ahead and order takeout food. You can open up your packages from Amazon or other vendors. That is not the main concern. The main concern is personal contact, social distancing, etc.
Okay, thank you. And before reading the other questions on the chat, if somebody finishes to ask a question, please mute yourself again so we can eliminate the background noise. The one question I have here before going on with others is 6 months from now, what is the worst case scenario? You think we understand its estimation, you know. What is the worst case scenario that can happen 6 months from now, and what's the best case scenario?
I mean,
Hard questions. Nobody said it would be easy.
the best case scenario is we have a treatment or a vaccine, but that seems unlikely. It's actually more likely we'll have a treatment than a vaccine. The vaccine will almost certainly take at least a year. We may get lucky with the antiviral research. The worst case scenario is this just becomes part of our lives for 12 or even 18 months, and that social contact gets limited for a truly extended period, creating tremendous economic hardship, tremendous emotional stress for many people, and also a large number of deaths. We have no idea how long this is going to go on. And Dr. Dreiher talked about the importance of flattening the curve, but as you might have noticed, if you flatten the curve, the outbreak goes on for a longer period of time. We need to do that to save lives. That's the only way our hospitals will not be overwhelmed. But if we flatten the curve, it does tend to go on for a longer period.
Thank you. Dr. Dreiher?
So I think that the best case scenario is that it will just go away in a few months, like the SARS did with a very limited number of months, but I know it's very optimistic. And the worst case scenario is that we'll have so many patients and so many people who need ICU support that really our health system will be overwhelmed, and we won't have enough ventilators and enough monitoring equipment for everyone, because you know the number of ICU beds in Israeli hospitals is much lower than in the States. So we will need to convert all kinds of other areas outside the ICU for mass ventilating and so on. And we might have challenges with that, with rising number of deaths and so on.
Okay, thank you. Now we're going to take some questions from our participants here. Ruth, raise your hand. There we go. Okay, Ruth, Ruth, please ask the question.
Okay, so I want to ask the question about the two medications that were presented yesterday by the president, one for Ebola, the other one for arthritis, or I don't remember what, and that they can successfully, you know, it's a magic pill. And for some reason, I have a feeling that that's another misleading information. So I mean, can they, if we don't even know the nature of this virus, how can we prescribe a medication that, yes, will kill us, but they're not going to cure us, and will just, you know, continue the situation, you know, and prevent us from getting to the bottom of it? That's
Would you like to comment? Which one?
Sure. The medicines that President Trump mentioned yesterday, chloroquine and hydroxychloroquine, have been used for malaria and for rheumatoid arthritis, respectively. There is a significant amount of evidence that in the laboratory, these medications prevent the virus from invading the human cells. That does not mean that they are going to be effective clinically in actually treating people who have the infection, and it doesn't mean they're going to be effective in preventing the infection. So we have a very long way to go. There are many medications that look good in the test tube and then turn out not to work when you actually give them to people who are sick. There is the most promising medication is an antiviral. I'm blanking on the name now, it's experimental, and that is showing some promise, but again, it will be months until we really know whether or not it works.
Dr. Dreiher, would you like to comment? Thank you, Ruth.
Yeah, so like Dr. Goldberg mentioned, there are some drugs that are being tested for this COVID-19 virus. Chloroquine has shown some limited evidence in a randomized controlled trial of 100 patients in China. So it's not like a multi-billion experiment with many patients all over the world. It's very limited, and we also have viral drugs that are being tested. Some of them are experimental, like remdesivir, and we are being given them as compassionate treatment from the companies. They are all kept for severely ill patients. They're not for people at home that feel okay and want to eliminate the virus. It's for people in the ICU on ventilators that are in real life and death situations.
Okay, thank you. If you can each share one coping mechanism while we're staying at home that has, other than social distancing, that is effective while we're facing this period of time, just one that you think will be effective and empowering for us.
I think communicating by phone and especially video, I think is very powerful. I had an interesting experience yesterday. For the first time, I did telemedicine with 3 of my patients. Usually either it's an office visit or a phone call, but this time, because we're discouraging people from coming to the office, we tried to deal with it by video conferencing. And I was surprised that I consider myself quite close to my patients, especially the ones I've known for a while, but I felt closer to them, and I hope they felt closer to me when I could see them. I was frustrated that I couldn't check their blood pressure, listen to their lungs with the stethoscope, but I think it definitely is I was surprised that there was a connection made when I could see them, and I would just encourage people to do that as much as possible. We are social animals.
Thank you.
Yes, so I agree. The semester has just started in our university, and usually I teach a course for quality and patient safety students. And we have to do it by Zoom for the last 2 meetings, and it went amazingly okay. It's like everyone participated and listened, and they were very focused on getting involved rather than playing with the smartphones in class. So there is also an upper side to this social distancing.
Okay, so on that note, what is the light at the end of the tunnel? Is there an up point to this pandemic? You may take a moment to think about that.
I'll let Dr. Dreiher answer that first. That's a tough one.
Yeah, so I think there are 3 lights at the end of the tunnel.
3 lights. 3 tunnels.
3 potential lights. One of them is that we might find a cure for the virus. The second one is that we might have a vaccine 1 year from now, I think is a minimal estimate. And my personal hope is that when the summer comes, it will be too hot for the virus to spread, but that's just being extremely optimistic.
Okay. We have a thread of questions here and everybody's eager to have their questions asked. So let's go and see. Ron, your question. Where is your question, Ron? Ron? Okay, I'm gonna go up by order here.
Ron was asking about long-term effects of corona.
Correct, thank you. What are the long-term effects of coronavirus?
I mean, I think there's concern mostly about long-term lung damage. That, and this is true really for other types of pneumonia. That's nothing unique. But if you have any kind of very bad pneumonia, there is often scarring of the lungs, and the lung function does not go back to normal. So the people who survive may be left with a permanent reduction in lung function.
Okay, I'll go to the next one. What is the level of collaboration and cooperation between the countries? This is a question from Galit in Israel.
Cooperation between Israel and the
Collaboration, especially between Israel and America, but also with other countries since it's a global pandemic.
Since the number of cases in Israel is relatively low, especially compared to other places like Italy and Spain, and also the States. So we try to learn from our colleagues in other countries that have experience. As I showed you before, we don't have many very severe patients. We know so far that the disease might worsen over a few days, even though we don't have a lot of patients in very severe situations. This might change even next week. So we consulted our colleagues in COVID-19 stricken areas like Italy and Miami and so on. So they gave us some tips. There was a conference call with experts from China yesterday that our infectious disease specialists participated, and they learned about their Chinese policy of isolation and so on. So I think this global village advantage has a lot of strength, and we can learn from each other and get tips from other countries. And also, someone might want to learn from us, like Dr. Goldberg said, that enforcing quarantine was a very strong policy that other countries should have adopted or can still adopt.
Thank you. And Dr. Goldberg, maybe you can address the collaboration worldwide between all of the countries and sharing of information. I mean, I don't, to the extent of that you know about.
Right. I mean, Dr. Dreiher would know more about this than I would. I think that there's tremendous cooperation among the scientists, which is what we'd expect. I'm not sure how much cooperation there is among the governments. I do think we might have something to learn from the Chinese and the South Koreans, and I'm not sure that we're asking, I'm not sure how much the leaders of the different countries are trying to coordinate their efforts. The scientists, though, are definitely working very closely together.
Okay, there's a question here from Claudia about millennials. What do you find most common symptoms among millennials? Can there be no symptoms at all? Not being able to taste or smell with a dry cough, for example, is that something to be worried about?
Yes, those are in fact the most common symptoms, but it's nothing to worry about. That at this point in time, if you develop symptoms of the common cold, such as stuffed nose, runny nose, sore throat, low-grade fever, achiness, mild cough, any combination of those, yes, there's a very good chance it's the coronavirus. Yes, you should immediately quarantine yourself, but if you're not having any trouble breathing, there's nothing to worry about. And as I said, if you're not sure you're having trouble, you probably aren't. When people are really short of breath, it's fairly obvious. But if in doubt, call your doctor. It seems that people can have no symptoms at all, but it's clear that especially among healthy young people, there are many cases that are mild or have no symptoms at all.
So I have a question that I've heard several times in the past few days in preparation for this meeting is, how do you get tested? Is there a hotline? How do you actually get yourself tested and some people to be responsive to you? So we're gonna do it in Israel and in America. Dr. Dreiher, how do you get tested in Israel where you feel that you wanna get tested because you experience these symptoms?
So it really depends. You should, if you have suitable epidemiological story, like you have been in quarantine and then you develop symptoms, or you came back from abroad and you have symptoms, or you think that you were in a contact with a patient because you work in a healthcare setting and so on, and then you develop symptoms, you call the MDA, which is the Israeli equivalent of the Red Cross, and they can come to your house and test you, and then they send the sample to the lab, and the lab gets the results in a day or two. If you're really sick with symptoms like Dr. Goldberg mentioned, you go to the emergency department, and then you get special negative pressure room. They isolate you, and if they think that you're really suspected of having the coronavirus, they test you, which does not mean that you have to be hospitalized, because if you're otherwise in a good condition, you can go home and be in quarantine, and then they will let you know if you're positive or not. And then they'll decide whether you should be hospitalized at home, as we call it, or go to the hospital.
Okay, thank you very much. Dr. Goldberg, in America?
Well, I'm mostly familiar with Westchester County where I practice. There is a drive-through facility in New Rochelle in an area called Glen Island, and you don't need an appointment, you don't need a doctor's referral. All you have to do is drive through, show your driver's license to identify yourself, and they'll do the test for you. It will take 2 to 3 business days to get a result back. I believe there are similar centers that are opening up all over the tri-state area, but I'm really not familiar with other areas.
Let's talk about problems of getting tested or some barriers. I have here somebody that actually contacted me just before today. She's from Crown Heights, the Chabad community. She's in her early 40s with 4 children at home. She has symptoms, she's feeling very badly, but she said when she went to get tested, they just told her to go back and get quarantined, stay home. Yes, she has tested, she has to wait 2 weeks, and she didn't even get the test. So she's saying that her community there, and she wants to stay anonymous, her community there is not really getting the attention, and even one of the rabbi and the doctors, young men, got coronavirus. What can you really do to really attend to maybe the underserved communities?
I mean, the first thing is that the importance of social distancing. I mean, I know they say it every night on television and the newspaper, and that is it's even harder, I think, in some ways for the Chabad, the Orthodox community, than for the rest of us, because there is so much intimacy in that community. It's one of the strengths historically of the community, but you can't go to shul, you can't, have weddings or mitzvahs, you just can't do it. And I read one online newspaper a day or 2 ago that said that in the Chabad, they were advising people over 65 not to go to shul, but that's not the answer. No one should be going to shul. And it's very, very hard. It is true that getting a test in most cases, for most people, is not that important. You just stay at home, and if you have symptoms, stay away from other people. But you have to practice social distancing, and that's what really matters.
Thank you, Dr. Goldberg. Dr. Dreiher, would you like to add, since you're in Soroka and you know a lot about underserved communities, being the Bedouin and others, less socioeconomic, or people that even don't have those communication channels that we've been experiencing here. How do you take care of all communities?
So first of all, I think the problem is less severe in Israel because everyone can call MDA or, as I said, the equivalent of Red Cross. Everyone has phones, so they can call them and get them coming to their houses. I agree that social distancing is important, and if you can be tested at home and not go to the emergency room when you can expose other patients, then it's better to stay at home and wait till they get to you. The underserved populations are also somewhat in a lower risk because they don't travel abroad so much. They don't go to cinemas and public places where they could have been exposed. They mostly stay with their own communities, and if their communities are not mixed with other communities, then there is less chance of having exposure. I agree that we have some issues with the ultra-Orthodox community in Israel that doesn't really hold to those social distance practices. Some of them still go on the street with no need or go to the synagogues and to yeshivas and so on. So there's a lot of talk about getting the ultra-Orthodox people to listen and do the same.
And offering tests maybe to those community, maybe a mobile test to go there and help. Is that an option?
All the tests are mobile because they come
But
to your house.
in certain communities that are not as proactive in getting it. I mean, she just mentioned the Chabad community in Crown Heights. Really there are a lot of issues there, but maybe we can talk about it offline and see how we can help. There are two questions about babies. And by the way, the woman, the mother of 4, is also a question about babies. When you have babies, when you breastfeed or you have babies around you, it's not like you can quarantine yourself in your bedroom. What do you do?
I think you do what you have to do. If you need to be with the baby, you're with the baby. If you're nursing, and it's unavoidable, you nurse. But it does seem that young children do not seem to get particularly sick from this. I've had that question also, and you create as much distance as you can, but with a young baby, sometimes there really are no other options, and we are reassured by the fact that we don't seem to have any children in the ICU on respirators, thank God.
Another thing that you can do is draw the milk and give it by a bottle to the baby. If someone can give it to him, I understand that it's very difficult for a newborn baby to be separated from his mother, but sometimes that's what you need to do. Although I agree that the risk of infection is not so high, and even if they get sick, most of the infants are not really symptomatic, and none of them was really severely sick.
Okay, there's a question here from Caroline about ibuprofen. Recently, it's been published that ibuprofen is not a drug that we should use with COVID-19. Is that the case?
Yes. We decided that we don't give any non-steroidal anti-inflammatory drugs like ibuprofen to our patients with COVID-19. We give them acetaminophen or other drugs that are available in Israel, and they are not from this group because there is some evidence that this combination of viral infection and non-steroidal drugs can cause some damage to the liver and so on.
I think the approach in the United States so far is different, where the authorities here say you can go ahead and give ibuprofen, but there's good arguments both ways. Tylenol, Dr. Dreiher referred to as acetaminophen. In the United States, that's known as Tylenol.
Okay, I have another question here from a WhatsApp group saying if about remaining sterile. It's if you use gloves and masks over and over and you go out, maybe not the mask, maybe not so much the gloves, is it it's okay to reuse it, or do you need to clean it up, or what's going on with reusing these masks and going out shopping, coming back?
There is absolutely no need and no evidence for people who do not treat patients to use either gloves or masks. Masks and gloves are intended for use in medical settings. I see a lot of people going out around the street with gloves and masks and so on. So if you do it to protect yourself from other patients, it's completely unnecessary. If you have symptoms and you want to protect others, as we said, stay at home.
Okay, so if you see somebody with a mask in the street, go the other way. Yeah. Go back home. Okay.
Away, quickly.
Okay. Goldberg, about any measures of just staying sterile and protecting, even in the home with your family members.
First, I agree 100% with everything Dr. Dreiher just said. When you're in the home, if you think you might actually have the coronavirus, you do need to stay 6 feet away or more. One of the questions I frequently get is, a husband or a wife will say, look, I've already been sick for 5 or 6 days. If I'm going to give it to my spouse, I've probably done it already. And the answer is that's true, but why not? Why take the extra chance? If you can minimize it a little bit by separating now, that would be a good idea. About the masks, again, I agree with what Dr. Dreiher said. You should be aware that historically in this country, we always tried to get a fresh mask every time we put one on. And in fact, we have to change that. There are these shortages of masks is so severe that the authorities are now saying we should try to reuse them as long as possible. That's not considered optimal, but even the healthcare providers who urgently need them have to start reusing them, otherwise we'll just run out completely.
Right. For the first time I'm here hosting, so I'm seeing some people raising their hands to ask a question, so that's wonderful. We are gonna go with David, Kimia, Emmanuel, and then Caroline. So David, I'm gonna unmute you now, and you can ask your question.
Good morning. Thank you, doctors, for briefing. It's very helpful to know. I have a couple of questions. I want to ask, how do you protect the medical staff when they are helping the patients with virus? How do you protect them? And they go to their families, they go to their wives. What protections you take in Westchester and in Israel?
Yes.
Okay, so first of all, we have guidelines from the government. Unfortunately, they change every few days, but so we're a little bit confused about that. But what we learn is that when you treat patients who are, of course, if they are positive for the virus or have a high risk of suspicion for the virus, you have to use N95 masks and gowns and gloves and hand hygiene and all those precautions. If you treat low-risk patients, then it's debatable whether you can use surgical masks or you also need the 95 masks. The Chinese told us that they only used N95 masks for everyone. So it's a matter of debate. Also, we have a shortage of N95 masks, and we had some issues with surgical masks that I hope that we've solved them so far. But really, the shortage of equipment is an issue. And we have some cases in Israel, fortunately not in Soroka, that people got sick because they were treating patients with COVID-19 and they got infected from their patients. We had a few staff members that had to stay at home, isolated because they were in unprotected contact with patients. But as far as I know, and I hope nobody got infected yet.
But in reality, when you admit a patient with the symptoms and you're not sure until you get the test back in 2 or 3 days, in the meanwhile, how do they know if the virus has been passed on to them? How do you protect these people at the hospital? Doctor from Westchester, Dr. Goldberg, can you answer that question, please?
Well, there's no way, at the beginning, there's no way to know if you've been infected. The first thing and the most important thing, I think, is that when somebody arrives in the emergency room, if there's any chance they have coronavirus, if they have a fever, cough, or even just the sniffles, they should identify that immediately to the receptionist. So they're immediately given a mask and sent to an isolation room. And the receptionists in the emergency room have to ask immediately if there's any about those symptoms, so these people can be identified. After that, all that you can do is follow the protocol, which is a single isolation room, wear a mask, gowns, gloves at all times. And if you do that, you lower the risk, but you don't eliminate it completely. The biggest problem has been patients who are in the emergency room or the hospital and no one suspected it. And if you're exposed to someone like that, then you have to go home for 2 weeks and quarantine yourself so you don't get it and then pass it on to someone else.
Okay, we're down to the last 2 questions because we want to be respectful of your time and everyone's time and end at noon. Did you want to add anything, Dr. Dreiher, about this? Okay, Emmanuel, I'm going to, Emmanuel, you can ask your question.
Yes, you recommended not to use Advil. I would like to know why and what would you recommend instead, please?
Thank you.
So as I said, we have some evidence that those Advil drugs, when you give them to patients with the COVID-19 virus, can cause damage to the liver. We see the same when, for example, when you give aspirin to children with the flu, they get issues. So we decided that we don't want to use them at all. We recommend the Tylenol, as you call it in the States. I learned from Dr. Goldberg, and so on. Just to be on the safe side, because these drugs can also cause other problems like renal failure and renal problems, and we're not so eager to use them anyway. We don't use them for hospitalized patients anyway.
Okay, I believe Jay Selman had a question. Jay, can you hear us?
What about Sudafed? Can you use Sudafed?
Yes, Sudafed is fine. The main concern about Sudafed is that it can make blood pressure go up. So if you have a history of high blood pressure, stay away from Sudafed. Sudafed doesn't really cure the virus. All it does is it relieves the symptoms of nasal congestion. But for people who do not have high blood pressure, it's generally safe.
Got it. Thanks.
So I'm gonna ask Jay's question. Jay, if we cannot hear you, if I can ask your question. Jay Selman, the president of the board of American Friends of Soroka Medical Center, would like to ask, how can we here in America, American Friends, support the efforts of Soroka Medical Center and especially the coronavirus unit? Thank you, Jay.
Thank you for the question. So as I said, we have a shortage of some equipment, for example, ventilators, portable digital radiology machines, and all those things that really help us treat those patients without exposing the staff to patients. For example, if we have more portable digital radiology units, then we don't have to take them outside to the X-ray rooms and do the X-rays there. We can insert a portable machine into the department and use it there. Also, we need more monitors, more protective equipment, 95 masks, and so on. So any help of that kind would be really appreciated.
Thank you very much, and we will continue our fulfilling our mission and doing whatever we can with the situation we have now and with the technological affordances that we have now to keep supporting Israel and Soroka Medical Center and the effort to cope and overcome. And maybe the last question is, Dr. Goldberg, Dr. Dreiher, and all the medical staff, you're doing such amazing, inspirational, and crucial work with that. When you come home at night, probably late at night, what are you most proud of?
The thing I was most proud of is our staff at Soroka, because when we opened the unit, we asked who is willing to go and work in this special unit, and we were really thought that we might have to force someone to come there. There were so many volunteers to work in this unit that we had to stop them and says, okay, we'll put you on a standby waiting list. If we have more patients, we'll call you, but now we don't need so many nurses and doctors, so I'm very proud of our staff in Soroka that really is so eager to help and do their job.
That's wonderful to hear. Thank you so much. Dr. Goldberg?
Everyone is trying their best in an extremely difficult situation. Everyone is working hard, and everyone is thinking of the patients first and doing everything they can to help night and day.
Thank you very much. So I thank everybody that came here and participated. Check out our Soroka.org website, be in touch, and we will continue. Please share the feedback with us, pazit@soroka.org, or just here through the chat, what you want to see next. Please stay in touch, and we will do our best to organize it together with your help. So toda rabba, Shabbat Shalom, labריאות.
Goodbye.
Goodbye. Thank you very much.
Thank you, everyone, and Shabbat Shalom to all.
Shabbat Shalom.
Okay, wait.
Thank you.